Welcome to Nick Solly channel. Like and hit notification bell for more updates. COVID-19. Coronavirus disease. COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette. For example, by coughing into a flexed elbow. Different COVID-19 vaccines. Vaccines save millions of lives each year. Vaccines work by training and preparing the body's natural defenses, the immune system, to recognize and fight off the viruses and bacteria they target. After vaccination, if the body is later exposed to those disease-causing germs, the body is immediately ready to destroy them, preventing illness. 1. Pfizer-BioNTech. The Pfizer-BioNTech COVID-19 vaccine in tocilizumab, sold under the brand name Comirnaty, is an mRNA-based COVID-19 vaccine developed by the German biotechnology company BioNTech. Who can get this vaccine? 1. People 12 years and older. How many shots you will need to shots given 3 weeks 21 days apart to when are you fully vaccinated? 2 weeks after your second shot. 2. Moderna. The Moderna vaccine is a vaccine that aims to protect against COVID-19. Who can get this vaccine? People 18 years and older. How many shots you will need to shots given for weeks 28 days apart. When are you fully vaccinated? 2 weeks after your second shot. 3. Johnson & Johnson's Janssen. Who can get this vaccine? People 18 years and older. How many shots you will need? 1 shot. When are you fully vaccinated? 2 weeks after your shot. On February 27, 2021, the U.S. Food and Drug Administration issued an emergency use authorization (EUA) for the third vaccine for the prevention of coronavirus disease 2019 COVID-19 caused by severe acute respiratory syndrome coronavirus to SARS-CoV-2. On April 23, 2021, the FDA amended the EUA to include information about a very rare and serious type of blood clot in people who received the vaccine. The EUA allows the Janssen COVID-19 vaccine to be distributed in the U.S. for use in individuals 18 years of age and older. 4. Sinovac vaccine. Today validated the Sinovac Coronava COVID-19 vaccine for emergency use, giving countries, funders, procuring agencies, and communities the assurance that it meets international standards for safety, efficacy, and manufacturing. The vaccine is produced by the Beijing-based pharmaceutical company Sinovac. It works by using killed viral particles to expose the body's immune system to the virus without risking a serious disease response. 5. Sputnik V vaccine. The Russian COVID-19 vaccine Sputnik V Covid-Vac is an adenoviral-based, two-part vaccine against the SARS-CoV-2 coronavirus. Initially produced in Russia, Sputnik V is a weakened virus to deliver small parts of a pathogen and stimulate an immune response. The Sputnik V Covid-Vac vaccine reduces the time taken for the actual development of immunity to SARS-CoV-2, the virus behind the COVID-19 pandemic. It is a vector vaccine based on adenovirus DNA, in which the SARS-CoV-2 coronavirus gene is integrated. Adenovirus is used as a container to deliver the coronavirus gene to cells and start synthesizing the new coronavirus envelope proteins, introducing the immune system to a potential enemy. 6. AstraZeneca vaccine. Who is the vaccine not recommended for? People with a history of severe allergic reaction to any component of the vaccine should not take it. The vaccine is not recommended for persons younger than 18 years of age pending the results of further studies. What's the recommended dosage? The recommended dosage is to doses given intramuscularly 5 ml each with an interval of 8 to 12 weeks. Additional research is needed to understand longer-term potential protection after a single dose. How efficacious is the vaccine? The AZ-D122 vaccine against COVID-19 has an efficacy of 63.09% against symptomatic SARS-CoV-2 infection. Who else can take the vaccine? Vaccination is recommended for persons with comorbidities that have been identified as increasing the risk of severe COVID-19, including obesity, cardiovascular disease, respiratory disease, and diabetes. That's all. Thanks for watching. Don't forget to subscribe.